Namaskar, I'm Dr. Vasanth Kumar from Hyderabad, Telangana. The first person to say the treatment for the COVID, dengue, chikungunya, and many more the viral infections, where you don't notice the antibodies in the after the infection. Well, now we see there's so many cases of Guillain-Barré syndrome complication of an post-infection of any viral infection and the bacterial. It is mostly 99% with all the cases with the viral infection. Yes, the bacterial infection which we found at the time of the in the hospital stay in all these cases of Guillain-Barré, the Campylobacter and Pseudomonas and all these things used to be attacked after the admission. But why do I say 99%? Because most of the cases had a viral infection prior to this Guillain-Barré syndrome. Notably, main causative things nowadays is the norovirus. Yes, norovirus has an ability to cause an Guillain-Barré syndrome in one of the study. The other causative things, the rare is the dengue, and common thing is chikungunya and other infections. What we see in this present scenario is COVID-19 and dengue. What happens when there is an infection? The viral infection decreases the immunity, and that increases the antibodies in the human body. When the virus is there, it attacks the virus. But when the virus is not available, then it is going to attack the human cells, whether it is whatever the type of cell. Here, the auto antibodies against the neuronal cells. These virus which attacks, these antibodies attacking the self-defensive system, the own cells in the body, causes this Guillain-Barré syndrome, that is attacking the nerve, demyelinating the nerve. That's why the people having the ascending paralysis, weakness of the lower limbs, followed by the upper limbs, followed by difficulty in swallowing, difficulty in breathing, and the cranial nerve involvement too. These sort of things usually has a respiratory illness prior to this one. This is a complication after the viral infection, whether it is norovirus, whether it is chikungunya, whether it is COVID, whether it is any sort of viral. Right now, bird flu is going on. You can suspect that because the more number of bird flu cases has been reported from Maharashtra, Nagpur, Latur. Whether it has been contaminated with this one or they had the infection and that has lead to all this condition, we have to see it. The complications, once the immunity is decreased, the autoantibodies adds attacking on this myelin. The death of a 64-year-old from Pune Municipality, she was admitted in November 24. It is now January. It is almost 2 months back she was admitted. Prior to that, she would have contact this infection might be in October to November. It is almost 4 weeks. If you see that one, she had an infection in October. At that time, the most prevailing things, the most infectious time of dengue, chikungunya, and norovirus too. These three viruses has capabilities of doing this complication of Guillain-Barré syndrome. These people, mostly out of 67 infected in the same the patients in the area, 13 have been on ventilator and one death. It's the biggest thing. And Modi, Prime Minister of India, Modi ji, ordered the Maharashtra government to look after this thing, which is serious. Why it is serious? Hospitalization, ICU admission, ventilators, and these all the things matters to everyone in this world. This is the first time in India where 67 cases at a time in a meantime of 2 weeks, 1 to 2 weeks, with one death. What are the virus that is causing these things is more important here. Chikungunya, already in August, September, October, November, if you had seen in Pune, dengue was there, chikungunya was there, norovirus was there, COVID was there, and even COVID vaccine, adenovirus vector vaccine, can cause this one, but we are not given this one at this time. Is there any as such things that is contributing to all the things with any sort of virus that comes along with this vaccine is more important here. Today, the virology department, which has been in the Pune itself, can see that antibodies, they can check that 67 sample antibodies, whether it is infected with any of this one. So the answer will be very clear. It is not that the stool examination of the patient is not that gives the correct appropriate answer. Why? Because of this type of syndrome or GBS, which is already the person is vague, opportunate co-infection that comes Campylobacter jejuni in the intestine hospital. It may acquired in the hospital too, but this is not going to be in a Campylobacter, though Campylobacter is present. I say it is 99% in all the cases of Guillain-Barré syndrome, the causative agent is the virus. I request they should have the antibodies, what all the antibodies tests that are available can be tested in the 67 people, and that can give the answer. Why it is so particular to that region of Pune and Pimpri village, Pimpri municipality, that is also the big question. Now the bird flu is going on in Maharashtra. Is it the causative thing? That should be focus. It is the first ever 67 cases in a short term period. The GBS is bigger thing. The person who died in this female 64 years in Pimpri village, axonal motor injury. There is a treatment which can stop the things for the virus if you take it in proper way, proper medication. These type of problems you can